Inside the larynx or the voice box, there are vocal cords. The normal mobility of the vocal cords are necessary for voice production. These vocal cords are not of single layer. It's in 3 layers. Only if I make you understand the structure of the vocal cord, you will understand this condition in a better way. The picture you see on the left side, this shows the vocal cords, and if you take a cross section of this vocal cord, it will look like this. So I have mentioned about 3 layers. These are epithelium, the outermost layer, then you have lamina propria, the middle layer, and the deepmost part, the body. The middle layer, which we call as lamina propria, is again divided into superficial, intermediate and deep. In the superficial layer, there is a potential space called Reinke space, which is filled up with gelatin-like material. When there is accumulation of fluid or when this space becomes edematous, it results in Reinke's edema. This is a picture of a normal vocal cord, and here you have the swollen vocal cords in a case of Reinke's edema. So, the Reinke's edema means vocal cords are swollen due to accumulation of fluid under the epithelium in the Reinke space. What are the predisposing factors? It is common in smokers, especially the females who smoke and those who misuse their voice, and if they have hypothyroidism, the chances of getting this is more, and the last one being severe acid reflux. It's more common in female, and the more commonest complaint will be they'll say there is a change of voice which is becoming worse, and associated with that they'll have throat irritation and irritative cough also. When the female who is affected with this Reinke's edema, when she talks on the phone, the person on the other side of the phone, they'll think that they're talking to a male. That means they have a masculine type of voice. In some cases, if left untreated, they have breathing difficulty too. We'll go ahead and do a flexible endoscopy in the endoscopy room, which hardly takes 5 minutes, and we don't need any special preparation for this. And when we put in the endoscope, we can see that the vocal cords are swollen up. It's not congested, it's swollen up. This is a real picture of a normal vocal cord, and that's how it looks in a case of Reinke's edema. So, we don't need any special voice related tests like stroboscopy and voice analysis. It can be done, but not necessary. This is a straightforward case. But we need to do thyroid function tests, especially thyroid stimulating hormone, to know whether the patient has got hypothyroidism or not. Coming to treatment. So, Reinke's edema can be graded as 1, grade 2, grade 3 and grade 4, or you can say mild and severe. So to start with, we'll advise a patient not to smoke and not to misuse the voice, and we will give a prescription for anti-acid reflux medication approximately for a period of 3 weeks to 1 month. And if suppose in the investigation it has turned out that the patient has got hypothyroidism, we need to treat that. This will be more than enough in a case of mild to moderate. Suppose it is grade 3 or grade 4, then the patient will need surgery. Surgery, we will not operate on both the vocal cords at the same time. It will be on one side where we will put in an incision, elevate the epithelium. We will not remove this, just elevate the epithelium. This excision up to here only will be attached there. And on entering the Reinke space, we will suck out all the edema or with the help of a cup forceps and reposition the mucosa. This procedure hardly takes less than 1 hour and the patient can be discharged the next day. During discharge, you will not have a course of antibiotic. Instead, you will get a mild painkiller for 2 days followed by anti-reflux medication at least for 3 weeks to 1 month with advice of voice rest for 7 days. Most of the patients, they'll have a cough, which they already had, and they have a habit of clearing the throat, which has to be avoided. And whenever they get this, it's better to sip lukewarm water. And sure, they had to stop smoking and not to misuse their voice. Not only that, please try to avoid whispering and throat clearing. Whispering is very bad. And if you suppose you have cough, whenever you start getting the cough, taking sips of lukewarm water, that will avoid the cough. And avoid hot spicy food items, likewise cold food items too. Better to avoid coffee, junk foods from outside, then beverages, drinks, lemon juice, all these has to be avoided. So that's how we treat a case of Reinke's edema. Thank you so much.